Hello friends, I am Dr. Prashant Panchalothia in Vet for Your Pet series. Today we will discuss maggot wounds. In this rainy season, maggot wounds are very common, and even in other seasons we find maggot wounds in many type of animals. It may be dogs, street dogs or cats, or sometimes even human beings. We find maggot wounds. Now what are these maggots? Maggots are nothing but the larvae of any type of fly. It may be house fly or it may be other type of poisonous flies that we find around in the environment. How to stop it? Fine. As you can see that it is because of the flies and other type of insects which sit over the wounds and put their larvae, put their eggs over there. These eggs, when they develop into larvae, they eat the flesh of the animal in which they are harboring. So, to stop them, very simple, we have to observe the hygiene. We have to keep cleaning the wound, identify the wounds and clean it. At the same time, you can apply antiseptic or some sort of film through spray of antiseptic solution. Or else you have to keep the surroundings clean for domestic animals and for the pets that you keep. If you keep your house clean, hygienic, without any flies flitting around the house, then there is a very less chance of maggots being developed. Now, suppose due to the walk or going outside and all, sometimes you may contact or your dog may contact maggot wound. In that case, what we have to do? First of all, clean the area properly and then use a forceps, or you may use a plucker to bring out the maggots. Now, if you find a very small, typically round hole from which you find blood coming out, there is maximum chance that it may be having maggots in it. Now, with such type of hole, you just put the plucker inside the hole and try to pull out whatever you can grab, and you may find that you have a larvae, you have a maggot in your forceps or in the plucker that you are using. Try to remove maximum maggots. Now, sometimes we may find few hundred or few thousands. It may be just very few, but very few is generally not possible because they multiply very fast, and whenever a fly keeps the eggs, they lay a lot of eggs. So because of that, you'll find hundreds or thousands of maggots. You have to remove as many as possible. After removing as many as possible, you have to place a cotton with turpentine in it, or it may be a gauze with turpentine in it, and keep it for about 10 minutes. Remove the gauze, and after that you will find that the maggots, they start coming out by themselves. Now, some people have tried the liquid ivermectin. Liquid ivermectin is extremely good for maggots, but it is extremely dangerous also. If there is an overdose of ivermectin, then the animal suffers. So to avoid any overdose of ivermectin, you can calculate the dose, because the rate of ivermectin is about 6 to 600 micrograms per kilogram. The available injections of ivermectin, the liquid ivermectin that is available in the market, its dose roughly calculates to, for 50 kgs, you have to use only 1 ml, 1 milliliter. So suppose your dog is about 25 kilograms, then you have to use only 0.5 ivermectin. Out of this 0.5 ivermectin, you may use 0.2 ivermectin to put in the wound so that the maggots start coming out and you are able to remove the maggots easily. And rest of the 0.3 you can inject subcutaneously. You don't overdose ivermectin in case of dogs. In case of overdose, you will find that the dog starts drooling a lot and it becomes lethargic, it won't move, and if it does, then it moves with a staggering rate. If you find something like that, due to overdose of ivermectin, which is based on history of ivermectin, then you have to take your dog or pet or street dog to a vet immediately. And then there are measures like intravenous medication and bottles, etc., by which we can revert. But if the overdose is too much, then it causes damages on liver and sometimes even coma or death. So ivermectin should be very, very carefully used, though it is one of the most popular and drug of choice. You have option of oral ivermectin also available in the market that you can give to your pet or the street pet who is not listening to you or who is not cooperating so far as maggots and removal of maggots is concerned. But physically, manually, you have to remove the maggots as many times as possible. Second option is turpentine oil. As I told you that you can put a gauze or you can put a cotton full of turpentine inside for 10 minutes, wait and then remove it, and after that you can take out the maggots. Now a third choice which I have personally used and found to be effective is benzoin, tincture benzoin. Just a few drops of it in the hole or in the wound does the trick, and most of the maggots you will find they come swarming out of the wound, and you can immediately get rid of these maggots which come out of the wound. Now, if you understand the dose of ivermectin properly, then you can use ivermectin effectively, usefully. After you clean the wound properly, what you have to do? What you have to do is, like, you have to apply some antiseptic cream, or it may be Ayurvedic malham, which is generally useful in such type of maggot wounds. If nothing else, and if you have turmeric in your house, you can apply turmeric and close the wound. It may be any other powder, which is antiseptic powder, which you can use over the wound. Sprinkle it properly. Now, the care to be taken is, it comes now, that you have to cover the wound in such a manner that there is no air supply in the wound. If you try to curb or if you try to stop the air supplying the wound, you will find that the maggots don't have any chance of growing again, multiplying or burrowing in the flesh of the animal or the pet dog that you are having at hand. For that, you may apply bandage over it. And if you feel that this dog or this other animal is not allowing bandage, then you may apply some sort of tape to keep over there. You may keep a bandage and then tape it properly so that it may remain there as long as possible. You can even use Elizabeth collar for a dog so that he may not lick the wound. But if he scratches the area, then you have to be more careful and try to protect the dog from himself and not scratching it. Time. Generally it takes 2 days, sometimes 5 days, even 10 days is possible in case the wound is a little bigger. My observation for a very, very large maggot wound, which I saw in a dog, it took about 1.5 months, about 50 days. And in case of camels or cows, etc., we find that the maggot wounds keeps going on for longer periods because sometimes they don't come back for the treatment. But if they come regularly for the treatment, you can expect a maggot wound to be taken care of in about 10 days to 30 days, depending upon how fast the skin comes. Now here I would also like to discuss that the skin is not to be removed because the skin might be intact and the inner flesh might have been eaten away or destroyed by the maggots. If you find that the skin has been improperly eaten away by the maggots or that it has really been spoiled, then only you have to cut the skin portion and remove it. But if it is normal in color, it has not blackened and it has not actually petrified, then you can keep the skin and the inner portion, the flesh, it will come back, it will be regained, and the wound will finally heal like an open wound. Now, the use of antibiotics in such a case. Here we use the antibiotics or antiseptics just to ward off any other secondary bacterial infection and also to protect the animal from any other fungal growth or infestation. Otherwise, basically antibiotic injection is not required, but to be on safe side, if you use it for a few days initially, it will be good. And you have to keep dressing the wound again and again. If you have any questions or queries, you can ask me directly. My number is 799-077-4805. I repeat once, 799-077-4805. Thank you friends. Have a nice day. Bye-bye.